Hi, Dr. Tom Lewis here, your medical scientist, giving you an update on the coronavirus. And the virus itself is SARS-CoV-2, an update as of March 19th, 2020. And here are the topics I want to cover in this video. Vaccine is on the horizon. Very good news. We should all take pause and be thankful for what the medical industry is producing for us. Viruses, more common than most believe. Ill-defined conditions top the list of diseases in America and actually globally. American healthcare ranks near the bottom globally, and that's been shown because it's believed that American population is more susceptible to the ill effects of this virus. Viruses linked to all major chronic diseases, not just COVID-19, the SARS-CoV-2 virus, but a variety of viruses that have been identified. In COVID-19, the disease is detected in infants. What's extraordinary about that? We'll go into that. Case studies from our team from 2017 and how to detect viruses and other pathogens, because not a lot of folks are doing that. What tests are out there and what tests are available? So we'll cover that as well. So first of all, Fujifilm has obviously a medical component, and their antiviral drug has been tested and shown to be effective against the coronavirus. And what we see here is patients given the medicine in China were negative in an average medium of around 4 days. I'm not going to go into that in great deal. You can look it up yourself. But one thing we need to consider is that vaccines are not always 100% effective. And I wrote a blog recently, which you can see here the link to, that shows that the most recent flu vaccine for 2020 is only 58% effective. And of course, the SARS-2 virus is much more virulent. So we hope this new vaccine is very potent, but we're in the very early stages. So obviously, protecting yourself by avoiding exposure and improving your health is really, truly your best defense against this epidemic right now. So really, the theme I have for today is if you're not testing, you're guessing. And what I want to present to you is that viruses are much more prolific and may be at the root of many, many diseases. Me and my team of medical doctors, and I've been trained by two of the best out of Harvard, Dr. McCulley, the pioneer of the homocysteine theory of cardiovascular disease, and Dr. Clement Tremp, who uniquely used the eye as a biomarker and window into your health for over 40 years at Harvard, have shown very clearly that we need to do more robust testing in medicine. And looking at viruses is pretty much ignored. And we need to dive deeper. Obviously, HIV made us more aware of viruses, but the ubiquitousness of viruses in the global population is really quite extraordinary and underappreciated. So let's dive into that. So viruses, more common than most believe. So here's an article from the New Scientist on viruses of the human body. And I have some of their abstract information here. But the key point is viruses, because of the onset of symptoms, was the only way to know if specific viruses were present. In other words, we're not testing populations in advance for their risk of disease associated with viruses. We're only been testing for viruses after someone has symptoms or disease. And of course, we've only been doing that only a few doctors in a few areas have we really been testing for viruses. And some of the newly identified viruses may underlie mysterious, unexplained diseases. So are these rare diseases? I would argue not. And this, of course, is the link to this particular article. So what are viruses? They're very tiny germs. You can read this. Different viruses attack certain cells in your body, such as your liver, respiratory system, or blood. And that's just such as it can attack other areas of your body as well. And, there are antivirals now, but for the most part, your immune system is the primary defense against viruses. When you get a cold, there's no treatment for that. Your immune system has to evolve immunity very quickly towards that specific antigen, the virus, and then it will slowly eradicate that virus, in some cases up to 14 days, maybe longer. But I think this point about attacking certain cells in your body, such as your liver, so on and so forth, this concept, not new, is called focal infection. So here I have an indication from Dr. Charles Mayo, founder of the Mayo Clinic, and this article is from 1924, and he discusses focal infection. His main focus was on pathogens of the mouth, oral pathogens that would cause disease, and the infection would start focally, or the other term would be locally in the mouth, but it can spread all over the body. We now know that periodontal pathogens lead to premature birth, cardiovascular disease, and now we're seeing even brain diseases such as Alzheimer's may stem from oral pathogens that get into our circulatory system. So let's look at how ill-defined conditions top the list of diseases in America. So this is a very credible source, the Kaiser-Peterson or the Peterson-Kaiser health system. And here you can see that so-called ill-defined conditions are the most prevalent and the most costly in our society. So an ill-defined condition can be fibromyalgia, chronic fatigue, even people with hypertension that can be up to 90, even 99% of the cases of hypertension are called essential hypertension. And the true definition of essential hypertension is elevated blood pressure of unknown cause. So even though you have hypertension, since the cause is not known, we'd have to classify that as an ill-defined condition. So American healthcare ranks near the bottom globally, and that's particularly true in the 36 most developed nations on our planet. So let's look at that. This is from the Organization for Economic Cooperation and Development, and it's very simple. It shows life expectancy, and you obviously want to be at the higher end of this curve, up here, versus healthcare expenditure per capita. And you can see that America is spending way more than all these developed nations, from Chile, Greece, Denmark, Luxembourg, Switzerland, yet our life expectancy is much lower. So obviously, even though we're spending a lot in testing and treatments, we're not getting to the right cause. We're not getting to these ill-defined etiologies, causes of diseases in America, particularly chronic diseases. And this was just published in the Washington Post. The coronavirus shows how backwards the United States has become. And in that article, they quote the OECD, showing that we are spending way too much and getting way too little out of our health system. So this is from the CDC, Chronic Diseases in America, and this is why many folks have said that the mortality rate, the death rate from the coronavirus may be much higher in America compared to other nations, is because we are plagued the most with chronic diseases. 60% of adults in the U.S. have a chronic disease. That's not even considering children. So it's a tremendous problem. 4 in 10 adults have 2 or more, and it's the leading cause of death and disability. Well shown that people with chronic conditions are much more susceptible and much more likely to have severe conditions and symptoms and die from the coronavirus. So viruses, very much underappreciated, is linked to all major chronic diseases. And we're focusing on viruses today, but really it is pathogens. So fungi, parasites, bacteria, viruses would all be of the same, lead to the same outcome, contributing to major chronic diseases. Let's explore that a little further. So first of all, here's the coronavirus statistics coming out of China, is that people with no health conditions are only experiencing a 0.9% death rate when they've been diagnosed with the coronavirus. And I would argue that we're not predicting well what people's real health status is. We all live on a health continuum. So none of us are either perfectly healthy or ill, 100% ill unless we've died. So we're all on a continuum somewhere. So even people who don't have cancer, hypertension, or these other chronic diseases may be at risk. And the only way to know is to test your physiology, to do a proper workup of your health to figure this out. But the trend is very clear. People with chronic diseases die at much higher rates when they're exposed to the disease. Why? They're already fighting on multiple fronts. Their immune system is overtaxed. So this virus, being very virulent, can come in to a susceptible host, your body, and wreak havoc and lead to higher rates of mortality. So when we look for results for a virus in cancer, for example, this is from the American Cancer Society. Just go to their site and do a search for virus. We find 443 hits on that website alone. Never mind PubMed, the National Library of Medicine, just the American Cancer Society. So here's a couple that I picked out. Viruses that can lead to cancer. Several viruses are linked with cancers in humans. Find out more. The American Cancer Society recommends the vaccine for the human papillomavirus. Do you think the HPV is the only virus that can lead to cancer, but it's the only one really we have a vaccine for? But here we see on the same website, several viruses are linked with cancer in humans. So this is what I'd call the tip of the iceberg in our true understanding of the relationship between viruses, pathogens, chronic diseases, and cancer. So cancer is not a separate disease from these other major chronic diseases. At the root, most of them probably have the same etiology, which is causation, root cause, or more importantly, root causes. So here's viruses and autoimmunity. So viruses just aren't involved in cancer, they're involved in autoimmunity. Lupus, rheumatoid arthritis, multiple sclerosis, all of those are in play here. So let's see what the abstract says. Type 1 diabetes, lupus, RA, Sjögren's, celiac, multiple sclerosis. So the list this is probably just a short list of the association between autoimmunity and viruses. Does a virus cause Alzheimer's? My good friend Judith McCloskey out in Switzerland published Alzheimer's, a spirochetosis back in 1993. And a spirochete is a bacterium. So it's not just viruses. So developing, more astonishingly, this is from Harvard Health. More astonishingly, when those who had been treated with antiviral drugs were compared with those not treated, the folks treated with the antiviral drugs were 90% less likely to subsequently develop dementia. So what is causing Alzheimer's? I would suggest a poor immune system that makes you vulnerable to pathogens. Virus is one such pathogen that may be related to many underdiagnosed causal factors in dementias, Alzheimer's, maybe even brain fog, depression, autism, anxiety. It's all in the same continuum. There aren't enough studies out there for this, but I think the associations are potentially very, very strong. So let's look at viruses with type 1 diabetes. We've been told that this is a genetic disorder, but the average age of onset for type 1 diabetes is 12 to 14 years old. And in twin studies, when twins have been separated at birth and have gone into very different environments, one may get type 1 diabetes, whereas the other one does not. So can this be a genetic disorder? Maybe to a small degree, but I would suggest that we haven't been testing properly for things, rotavirus, cytomegalovirus, and other viruses. And we can see here that some viruses can be found in pre-diabetic and diabetic individuals. And I'm suggesting that what the authors are saying is that this is also type 2 diabetes. So viral triggers for type 1 diabetes and possibly type 2 diabetes. Cardiovascular diseases due to viruses. We have a couple references here, and there are many. So this virus is increasingly recognized as a cause of myocardial disease and may cause chronic cardiovascular diseases. And the viruses may come from the parent. Transplacental infection during pregnancy may occur. And this is right now debated about the coronavirus. Is it transmitted from mom to an infant, or is it, does the infant acquire it? Because now we're seeing infants with the coronavirus during birth or right after birth. We don't know exactly yet, but there are infants with coronavirus. So infections have been recognized as significant causes of cardiac diseases for many decades. Has your doctor told you about this? I referenced Dr. McCloskey since 1993 talking about this. And all classes of microbial agents may lead to cardiac diseases. Once again, fungi, molds, parasites, Toxoplasma gondii, and others, bacteria, chlamydia pneumoniae, highly associated with cardiovascular diseases, and of course, viruses. All components of heart structure can be affected by infectious agents. So atrial fibrillation, congestive heart failure, heart attack, stroke, and a new breed of infections have evolved over the past 3 decades. So these things multiply, and their life cycle, their generational time is very short. So even though we may have a vaccine, these things can morph into a resistant form. And we now know for bacteria, a lot of antibiotics are no longer effective because of overuse, and the pathogen has morphed into a new form that's resistant to the antibiotic. So once again, if you're not testing, you're guessing. If you have any number of chronic conditions, cancer, heart disease, autoimmune, diabetes, has anybody looked in your physiology for stealth bacteria? Lyme would be classified in that group. Lyme can be both acute, where you have obvious symptoms, but it also can be chronic, and we call that cryptic. You may have been bitten by a tick when you were 10 years old, and you have symptoms manifest when you're 60, or when you get sick and you're younger, but you've been, in that case, you're compromised in terms of your immunity. So that Lyme bug, which may be still resident and hiding in your body, comes back out to play. The classic example is chickenpox, herpes zoster virus. You can have shingles later in life, but you were infected at birth. We all have it. So is that the only organism that can come back out to play later in life? I suggest that that is not the case, that almost all of these can go into a spore form or a hidden form and come back out to play later in life. So let's look at COVID-19, the disease, or the SARS-2 and infants, and what's extraordinary about this. And you're going to hear the same theme I've been talking about over and over again. So there's mixed information about that. The coronavirus infection during pregnancy does not pass from mother to newborns. And here's some studies on that for you to take a look at. So a study of 9 pregnant women with laboratory confirmed COVID-19 pneumonia didn't appear to lead to a transmission in the infant. But yet, here's another study. A newborn tests positive for COVID-19 in London. So, but the point is, doctors don't know if the virus passed to the baby in the womb or sometimes during or after delivery. And what I'll warn you about is that your OBGYN may suggest C-section, but there's not good evidence, if you read these studies, that a C-section is a better form of birth compared to a traditional vaginal birth. And we now know that a vaginal birth actually sets up infants for better immunity later in life. So I would suggest that if you're worried about this, really dive into it and weigh the pros and cons versus of a C-section versus a traditional vaginal birth. But what about other congenital viruses? So that's the point I'm making here, is that we're testing for the coronavirus in infants because of the grave concern about this disease, and we're looking at the moms who have this disease. But what about other congenital viruses? Are we testing them? So can we assume that they're not passed to the infant? I don't think we can, because we're just not doing enough testing for these types of organisms in healthy and unhealthy moms and kids that are born with respiratory diseases or develop autism or other early childhood diseases, and even diseases that manifest later due to the fact that these organisms can be sneaky and hide for a long time in our body. So let's look at some case studies, because we've been testing for both stealth infection and viruses for a long, long time. Dr. Tremp from Harvard, the ophthalmologist who taught me most of what I know, was testing for these things back in the 1980s and 90s. So here's 3 case studies that have clear connection between viruses, bacteria, the disease that's most prolific in the individual, and resolution of their symptoms. So I apologize. This is a fax in our EMR for this particular person who had chronic migraines. And in fact, the migraines were so bad, this person had migraines from the age of 18 to 41 every day of her life when she woke up. And in her 20s, she was taking 4 medications just to get through the day. But what did she have? HSV, herpes simplex virus. HSV6, so HSV 1 and 2. HSV6. Epstein-Barr, all positive according to Quest diagnostic criteria. Toxoplasma gondii, a parasite that can go intracellular, get into tissue, get in the brain. The reason why pregnant women are warned about Toxoplasma gondii and cat feces is because this parasite is known to impair brain development. And if it can impair brain development, it can impair brain function. Chlamydia pneumoniae, which is well documented to infect endothelial tissue, the vascular, your blood vessel lining, and create inflammation. So here's positive chlamydia pneumoniae. Mycoplasma, walking pneumonia. We've seen many cases of pulmonary edema that we've tied back to Mycoplasma pneumoniae infection. And here we see some bands on the Western blot positive for Lyme disease. And here's her testimonial. Basically, we treated her by helping her improve diet, exercise, the usual suspects, but then we treated her specifically for the viruses, the parasite, and the bacterial infection. And she improved significantly, and this was over just a 3-month period where her headaches were significantly reduced. She was reducing medications, and as we continued to treat her, she got even better. And she said she was much more resilient to cold and flu after our program with her. So here's a lady in her 60s with severe skin disorder, psoriasis, chlamydia pneumoniae, bacterial infection, Mycoplasma pneumoniae, bacterial infection, Lyme disease, only 1 band reactive, but I would suggest if you have any bands reactive, you're not necessarily positive Western blot, but in my view, because of the stealth nature of these infections, you're positive. Toxoplasma, cytomegalovirus, Epstein-Barr virus, herpes simplex virus. This is what we treated. She had had all kinds of treatments. 3 dermatologists treating her topically. Infrared treatment. The disease getting worse. We treated these organisms, and this is what we saw in 6 months' time. So, can we prove cause and effect? I think the evidence is very, very clear. And then severe rheumatoid arthritis. A gentleman in his 60s, morbidly obese, type 2 diabetic with an A1C of over 8. We did some basic things, improved nutrition. Cod liver oil is my favorite supplement, so he was on high-dose cod liver oil, as are all our participants and patients, depending on who's proctoring over their health. But here we see very high herpes simplex virus, 1 and 2. Herpes simplex virus, 6. Epstein-Barr, cytomegalovirus, mycoplasma, chlamydia pneumoniae. This is severe rheumatoid arthritis where this gentleman could not make a fist, was going on disability because he worked a machine, and 5 months later, he had startling improvement, reduction in swelling, but more importantly, reduction in all his physiological biomarkers, including his A1C, which in 5 months came down from 8.8, type 2 diabetes, to 5.3, not even pre-diabetic, and he lost 25 pounds. So you might be wondering, who can you go to and how do you detect viruses and other pathogens? Well, most labs have the ability to test for these organisms. The issue is you have to be working with a healthcare provider that understands the potential relationship between these diseases, a variety of diseases, the disease you may have, and the pathogens. Otherwise, you're not going to get an order for these tests, and you won't know whether you have the pathogen or not. And then you might wind up on disease management, where we're just managing symptoms of the disease, but we're not getting to the root cause. So here's our program. We have a variety of options. Here we have what's called a deep shotgun metagenomic sequencing. In this case, there's a library of tens of thousands of DNA samples for known viruses. And we draw blood, 1 tube, it goes to the lab, and they do forensics analysis of DNA strands in your blood versus the library of known viruses and look to make matches. The same with other pathogens like bacteria. So that test is also available. Again, a huge library of all types of pathogens, their DNA. We take your sample and do a match. So here, we don't specify what to look for. We just send the sample in, and the lab determines by DNA matching what pathogens, viruses you have. In this case, we do a simple screening, a 6-pathogen test. And here we have what we call usual suspects, things that show up time and time again. Lyme, chlamydia pneumoniae, mycoplasma pneumoniae. And so we specify to the lab that we want you to test for these pathogens. And then we see the test results. Obviously, they're doing PCR, they're doing antibody titers, looking for immunoglobulins that your body produces as an antibody response to those specific infections. And that's how we know whether you're positive for those or not. But we look mainly in the chronic phase, and a lot of infectious disease doctors think that when we do an IgG test, it's indicative of past infection, not current infection. But every case study I just showed you, we only tested for quote unquote past infection through IgG. And you can see from our results that, and it's completely corroborated by many, but not enough, that IgG positive, you are positive in a chronic state or a chronic phase, it's not a historic pathogen. And here is a more comprehensive panel we offer where we look at both chronic IgG titers for the pathogens, but we also in some cases look for the IgM, just to understand, has there been a recent exposure to the pathogen? So that's it. If you're not testing, you're guessing. The coronavirus pandemic has really presented us with an opportunity for a better understanding of your health, of the causation of chronic disease, and the need for more robust testing to determine, particularly in ill-defined conditions, and even the most common chronic conditions, cancer, heart disease, Alzheimer's, autoimmune conditions, and diabetes. What is really driving this? If you are on a medication for life, the healthcare system hasn't solved the underlying or root cause of what's driving these diseases. So being a medical scientist, I'm an advocate for much more robust testing. And this doesn't mean more expensive testing. It doesn't mean large, CAT scans and colonoscopies and MRIs. Not that I'm against those, but they're very expensive and they're not pointing us to the root cause of why we might have polyps or cancer in our colon, or why we may have heart disease, or why we may have diabetes. So if you're not testing, you're guessing. My name is Dr. Tom Lewis. I'm a medical scientist, and I hope you found this information helpful to you as you move forward on your new health journey after this pandemic. Thank you so much.